You've likely heard that as we get older, we should expect a few more aches, a little less energy, and maybe a few more trips to the pharmacy. It's become the normal narrative of aging. But there is a dangerous gap in that narrative. A silent, creeping factor that often gets blamed on just getting older when the real culprit is sitting right there in your medicine cabinet. If you are over 60 and you're currently taking 1, 2, or even 5 different medications, your heart isn't just dealing with the natural process of time. It is navigating a complex chemical landscape that was never truly designed for an aging cardiovascular system. The truth is, a pill that was perfectly safe for you at age 50 can become a hidden burden by age 70. Over the next 20 minutes, I am going to reveal 5 specific types of medications that quietly affect your heart. We aren't talking about bad medicine or mistakes made by your doctor. We are talking about the way these chemicals interact with a heart that has less reserve, less flexibility, and less room for error than it did a decade ago. I'll show you exactly how these common prescriptions can mimic the symptoms of heart disease, and more importantly, I'll give you the exact questions you need to bring to your next appointment to ensure your heart is being protected, not strained. By the end of this, you'll have a clear, actionable checklist to ensure your daily routine is working for your health, not against it. We're going to peel back the layers on why normal side effects are often the body's way of whispering a warning. And stay with me, because there is one particular combination of common drugs that I see tripping up even the most careful patients. And once you understand it, you'll see your daily health routine in a completely new light. Let's look at the reality of your heart after 60. To understand why this matters, we have to talk about what actually happens to the heart as we pass that 60-year milestone. Think of your heart as a pump that has been working faithfully for 6 decades. It's handled millions of contractions, adapted to countless stress tests, and kept your body moving. But an aging heart doesn't have the same cushion it used to. In your 40 seconds, if you were slightly dehydrated or missed a meal, your system compensated almost instantly. Your blood vessels were flexible, your electrical signals were crisp. But now, that flexibility has changed. The muscle itself is slightly stiffer. The electrical pathways are a bit more sensitive to shifts in minerals like potassium or magnesium. And the kidneys, the filters that clear these medications from your bloodstream, are likely working at a different capacity than they were 20 years ago. This is why, for an older adult, side effects are rarely just annoying. They are often signals that the heart's reserve is being tapped into. Quick favor before we go deeper. I really want to understand the community watching this. Drop your city, state, or country in the comments below. When I see where you're watching from, it helps me get a better sense of the different health environments you're navigating, and I read every one of those to see what's on your minds. I can't give personal medical advice, but knowing who is listening helps me tailor these breakdowns to the real challenges you're facing where you live. Now stay with me, because I want you to understand that this isn't about being frail, it's about being precise. When you understand how your heart's reserve works, you stop accepting "you're just getting older" as a final answer. Most of the time, that phrase is just a placeholder for a question that hasn't been asked yet. Why is this happening now? And is there a better way to support my heart? When we look at the specific drugs that cause these shifts, we aren't looking for villains. We are looking for better fits. And that starts with recognizing that your heart deserves a specialized approach, one that respects the fact that your body today is not the body you had when you were 50. Let me tell you about someone I'll call Margaret. She was 69, active, sharp, and someone who prided herself on being the backbone of her family. She had a small list of maintenance meds, a common profile for millions of Americans. She took a standard, over-the-counter pain reliever for her occasional knee soreness, a mild blood pressure pill, and a daily supplement for digestion. For years, this routine was invisible. It was just part of her morning ritual, like pouring a cup of coffee. But then, the whispers began. It started with her rings. She noticed they felt tighter in the afternoons. Then came the fatigue. She'd be in the middle of a simple task, folding laundry or prepping dinner, and suddenly feel as though she'd just run a mile. She told herself it was the summer humidity. She told herself she was just having a lazy week. Even when her doctor mentioned her blood pressure was a little bouncy, she assumed it was just stress from a busy month. She ignored the swollen ankles. She ignored the new heavy feeling in her legs. She even ignored the fact that she was reaching for that extra pillow at night to breathe more easily. Why? Because these things didn't look like heart disease to her. They looked like growing old. But here's the kicker. Margaret's heart was essentially trying to swim upstream while carrying a backpack full of rocks. Her medication combination was quietly causing her body to retain fluid and creating a subtle but persistent load on her heart muscle. It wasn't a sudden, dramatic event. It was a slow, daily erosion of her heart's ability to keep up. The tragic part? She was doing everything right. She followed the instructions. She was compliant. She trusted that if the medicine was causing harm, she would know. But your heart doesn't always send an alarm. Sometimes it just lowers your tolerance for daily life. And because Margaret didn't connect her normal symptoms to her normal medications, she spent months living with less energy than she deserved. She thought she was fading. In reality, she was just being burdened. When we finally sat down and actually mapped out her medications alongside her symptoms, the picture shifted entirely. We didn't need a miracle. We needed a review. That realization, that her symptoms were a clue, not a fate, was the turning point for her. This is the trap. We assume that because we feel off but not dying, we are fine. But in your 60s, 70s, and 80s, feeling off is often the most important signal you'll ever get. It's the difference between protecting your independence and slowly giving it away. So, how does a simple medication turn into a cardiovascular burden? To understand this, we have to look at how your body handles chemistry after 60. Think of your cardiovascular system as a closed hydraulic loop. You have the pump, your heart, and the pipes, your arteries and veins. In a younger system, if the pipes become a little narrow or the fluid volume increases, the pump has extra horsepower to compensate. It just beats harder, or faster, or more efficiently. But as we age, that extra horsepower diminishes. This is what we call a reduction in cardiac reserve. When you take certain medications, they can affect that hydraulic loop in 3 specific ways. First, they can influence sodium and water retention. Some drugs, even ones you buy without a prescription, tell your kidneys to hold on to salt. Where salt goes, water follows. That adds volume to your blood. More volume means the pump has to move more fluid through the same pipes. For a heart with lower reserve, that extra fluid is like walking up a hill with a weighted vest on. You might not notice it at first, but your stamina will eventually drop. Second, some medications affect peripheral resistance. They might cause the small blood vessels to tighten or lose their ability to expand when you stand up or move. This forces the heart to work against higher pressure, beat after beat. Third, and perhaps most subtle, is the effect on myocardial contractility, the actual physical force of your heart squeeze. Some medications, even those meant to treat high blood pressure or heart rhythm, can dampen that force. In a younger heart, this is manageable. In an older heart that's already borderline, that reduced squeeze can lead to that heavy feeling in the legs or the dizziness that hits when you stand up from a chair too quickly. It is a cumulative process. It is rarely one pill that breaks the camel's back. It is the combination of a slightly stiff heart, a change in kidney filtration, and the collective load of 2 or 3 daily medications that together create a burden the heart can no longer manage quietly. You aren't failing and your heart isn't dying. It's just being asked to do more than it is currently built to handle. And the key to fixing this isn't just taking more pills to treat the symptoms. It's understanding which pills are contributing to the load in the first place. I need to stop you here for a second because I want to challenge a belief that I know many of you have held for years. Most people think that if they've been on a medication for 5 years and they haven't had a major emergency, that the medication is safe. But I want you to reconsider that definition of safe. Safe shouldn't mean I haven't been hospitalized yet. Safe should mean this medication is helping me live the life I want to live. If you are on a drug that makes you feel sluggish, keeps you from taking your morning walk, or makes you feel like you need a nap by noon, it is not just a side effect. It is a trade-off. And for many seniors, it is a trade-off they didn't realize they were making. Here is the reality of the system you are navigating. Doctors are incredibly smart, but they are often stuck in a cycle of symptom chasing. You have a symptom, you get a pill. The pill causes a new, minor symptom, so you get another pill. Before you know it, you're managing the side effects of your original medication. I see patients who are taking medications to treat the symptoms caused by other medications. They think they have a new problem, when in reality they just have a medication problem. This isn't because anyone is doing a bad job. It's because modern care is fragmented. Your primary doctor might not know about the over-the-counter supplement you bought at the grocery store, and your specialist might not have the time to review the 6 other prescriptions you're taking from other providers. The danger isn't that you're being poisoned. The danger is that you are being overlooked by a system that is moving too fast to see how these drugs are dancing with each other inside your body. You are the only person who is present for every single dose every single day. That makes you the most important part of your own care team. To prove that this isn't just my opinion, let's look at what the actual research tells us about the medication burden in older adults. A significant peer-reviewed study published in the Journal of the American Geriatric Society looked at exactly this issue. Researchers investigated the concept of polypharmacy, which is just a medical term for taking multiple medications at once, and its direct link to cardiovascular outcomes in patients over 65. The findings were sobering. They discovered that when older adults are on a regimen of 5 or more medications, the risk of adverse cardiovascular events increases exponentially, not just because of the individual drugs, but because of the cumulative interaction. The study highlighted something called prescribing cascades. This happens when a doctor prescribes a new medication to treat a side effect of a previous medication, without realizing that the original drug was the cause of the problem. They found that in many cases this led to fluid retention and decreased cardiac output, which the researchers linked back to poor daily stamina and increased fatigue in the elderly. Another study from JAMA Internal Medicine specifically looked at how certain common medications, ones people often view as harmless, actually affect the heart's electrical stability. They found that when combined with common electrolyte imbalances, which are very easy to develop as we age, these drugs could increase the risk of irregular heart rhythms. What does this mean for you? It means that the science supports the idea that your medication list is not a static document. It is a living, breathing component of your physiology. The researchers concluded that proactive, regular medication reviews are one of the most underutilized tools we have for improving the quality of life for seniors. The takeaway here is simple. Your body is constantly reacting to the chemical mix in your blood. When those chemicals are reviewed regularly through the lens of your current age and current heart function, the results can be transformative. It's not about finding a magic pill. It's about removing the burdens that are preventing your body from working at its best. Now let's get into the specifics. I have curated a list of 5 categories that I prioritize first when a patient over 60 comes to me with unexplained heart fatigue or off feelings. Again, these aren't inherently bad drugs, but they are the ones that demand the most scrutiny in an aging heart. First, the NSAIDs. This includes your ibuprofen, naproxen, and diclofenac. We treat these like candy. We take them for a stiff knee, a bad back, or a headache without thinking twice. But for an older heart, these are heavy hitters. They force your kidneys to hold on to salt, which pulls in fluid, which directly increases the workload on your heart. If you take these more than twice a week, your heart is likely feeling the pressure. Second, specific calcium channel blockers. Drugs like diltiazem and verapamil are effective, but they can be tricky. They don't just relax your blood vessels, they can also dampen the force of your heart's squeeze. If your heart is already marginal, this can lead to that heavy, exhausted feeling in your chest and legs. Third, proton pump inhibitors. These are the acid reflux pills like omeprazole or pantoprazole. We often start them for a short-term issue and end up taking them for a decade. The catch? Long-term use can interfere with how your body absorbs vital minerals, specifically magnesium. And without enough magnesium, your heart's electrical system can become unstable. Palpitations or a fluttering sensation are often the first sign that the balance is off. Fourth, thiazolidinediones. These are certain diabetes medications. They are excellent for blood sugar, but they are notorious for causing fluid retention. If you notice your ankles swelling, don't assume it's just the weather. Check your medication list. This drug could be the reason your heart is struggling to move that extra volume of fluid. Fifth, tricyclic antidepressants. These include drugs like amitriptyline. They are sometimes used for nerve pain or sleep. However, they can alter the reset timing of your heart's electrical system. This is what we call QT prolongation. When you combine this with the other medications I mentioned, you're essentially creating a perfect storm for rhythm trouble. These 5 groups are where I see the most hidden cardiovascular strain. If you are on one of these, or a combination of them, you have a specific, concrete reason to schedule a review. You have the information. Now let's make it work for you. I want to give you a specific strategy that will turn your next doctor's visit into a masterclass of health maintenance. I call this the tabletop review. Before you set foot in your next appointment, I want you to go into your bathroom, your kitchen, your nightstand, everywhere, and gather every single thing you put into your body. This includes your daily prescriptions, your over-the-counter painkillers, your acid reflux tablets, your sleep aids, and even those vitamins or supplements you bought at the grocery store. Put them all on the kitchen table. Now, I want you to take a piece of paper and write down 3 things for every single item on that table. Why exactly am I taking this? Was it for a temporary problem that has since cleared up? How long have I been on this? Has it been years since you last evaluated the dose? What changed in my energy or symptoms after I started it? Be honest with yourself here. Look for those subtle shifts. This list is your superpower. Most doctors are incredibly busy, and they often assume your current list is your required list. When you bring this tabletop list into the office, you aren't just asking for a refill. You are saying, I want to do a deep dive review of my heart's chemical load. Bring this list to your primary care provider or your cardiologist and say these exact words. I've been learning about how my heart's reserve changes as I age. I'm concerned about the cumulative effect of these medications. Can we look at this list together and identify if any of these are contributing to my fatigue or fluid levels, and are there safer alternatives we could consider? That phrasing does 2 things. It shows you are an informed, proactive patient, and it gives your doctor a clear, organized roadmap to help you. It removes the guesswork. It moves the conversation from, I'm just getting older, to, let's optimize my heart health. Remember, your doctor wants you to be healthy, but they can only act on the information they have in front of them. When you provide the full picture, you empower them to provide the best care possible. You are not a bother for doing this. You are being the primary guardian of your own longevity. This is the most respectful thing you can do for your heart. Part 9. So, here is my final thought for you. Protecting your heart isn't about chasing perfection or living in fear of your medicine cabinet. It's about clarity. It's about realizing that you have a voice in your care and that your daily comfort is the most important indicator of your health. Don't wait for a crisis to start asking these questions. Your health is built in the quiet, everyday moments. The way you feel when you stand up, the way you catch your breath, the way you move through your morning. If those things are changing, don't just accept it as the cost of aging. Respect the signal, review your list, and have that conversation. If this video helped you look at your health routine differently, please give it a like. It tells the platform that these deep dive health conversations are important for our community. And if you want to keep staying ahead of these issues, subscribe, because in our next conversation, we're going to break down the specific symptom clusters that signal a medication interaction, rather than just aging. That next step could save you weeks of confusion. You have a lot of life left to live. Let's make sure your heart has the support it needs to keep up with you. Take that list, make the appointment, and take charge of your health today.